Hello, this is Dr. Morris, and I want to talk to you briefly about carpal tunnel syndrome. Carpal tunnel is typically when we have numbness in these three fingers along the median nerve distribution. This happens when our wrists are curled. This often happens at night. So if you're having night numbness and you have to wake up and shake out your wrist, you probably need to either slide your wrist underneath a pillow so it doesn't bend, or you need to sleep in a carpal tunnel night splint. Often you need to try that for at least 4 to 6 weeks before coming in and seeing us and saying you got a problem, because oftentimes this can be fixed by you at home. Anti-inflammatories are helpful as well. Another reason this could be happening is you're typing incorrectly, your posture is not appropriate at the keyboard, or your job causes you to bend or grip repetitively. In that case, you may need some job modifications, some technique modifications. You need to use your tools to try to alleviate the discomfort. If it ever comes to it, the fix for carpal tunnel temporarily would be a steroid injection. This can happen if there's some transient condition like you're painting your house or you're pregnant. Something that's a temporary thing, the steroid injection is a good option. It can get you by. If you have numbness for too long that's not fixed by the splinting, we don't want that numbness to become permanent. That's when we would consider surgery, which involves usually a 15 millimeter incision at the base of your palm to release that transverse carpal tunnel ligament. And prior to making that decision, we'll often get a nerve test, a nerve conduction study, that will confirm whether or not it's your median nerve being pinched at the wrist, or perhaps there's a cervical root radiculopathy, or there's some crossover with your elbow, which can be cubital tunnel. Once you go into surgery, you really want to have that sorted out, and that's when the nerve test can be helpful. But I hope that helps, and hopefully some night splint, keeping your wrist flat, can avoid you having to come in. Have a good day.